Welcome to Fear-Free Childbirth Podcast with Alexia Leachman, the weekly 9-month podcast to help parents-to-be look forward to their fear-free childbirth. Alexia is a pregnancy and head trash clearance coach and the author of Fear-Free Childbirth, How to Have a Stress-Free Pregnancy and a Positive, Pain-Free Birth. As a mum who's had 2 fear-free and pain-free births, Alexia wants to share with you how she overcame her pregnancy and childbirth fears so that you can look forward to having a fear-free birth too. Over the 9-month life of this podcast, Alexia will be sharing some real-life stories from mums and dads, insights into the latest childbirth research, inspiring tales from birth professionals, and some tips and techniques for clearing your fears and stresses. If you would like to receive a free chapter from her book, then head over to fearfreechildbirth.com, where you can also sign up for her email series, How to Have a Stress-Free Pregnancy. But now, it's time for the show.
Hello and welcome back to the Fear-Free Childbirth Podcast. This is me, your host, Alexia Leachman. Thank you so much for joining me today. Now, on today's podcast, we're talking about natural birth. So what is natural birth? Well, a natural birth is an unmedicated one, and that is to say it's free of medical interventions such as pain relief or anaesthetics. So why would you opt for a natural birth then? Well, personally, I chose to aim for a natural birth because I wanted what was best for my baby. And I don't know about you, but when I was pregnant, I was really conscious about trying to do the right thing for my baby, so fitness, eating well, avoiding certain foods and drinks, that kind of thing. And so for me, it seemed perfectly natural to kind of extend that right into my birth choices. And when I started looking into all the various birth choices available and the impact that each of those choices has on you or the baby, when you're weighing up the pros and cons, it really was a very quick decision for me that I wanted to go for a natural birth based on everything that I had picked up and read and all the research that I had done. Now, I say aiming because I think aiming's quite right, really. You can kind of decide that that's what you would like to have, but that doesn't necessarily mean that that's what you will get on the day because, well, birth is such a complex process that anything could happen on the day. There might be any number of complications that might arise, just even something simple like baby not being in the right position, having done a last minute cheeky turn. Suddenly, if feet are down, then, it's best not to go for a vaginal delivery in that situation, or at least that's what your care providers will say. And so suddenly all your desires of having a natural birth or a vaginal birth go out the window, and it's not really to do with anything that you may or may not have done. So we just have to kind of be okay that things might change, but certainly you can still plan for a certain outcome. Now, the thing about opting for a natural birth is obviously because you're not having the pain relief through the medication, then it is even more important to plan for it because in order for you to help manage the pain levels and manage the process, there's a lot of other techniques that are worth learning and practicing using in the lead up to the birth. And of course, getting rid of your fears is also a huge part of minimising the pain that you'll experience in childbirth as well. So that also takes a lot of time and preparation before the big day. But what I really want to focus on today's podcast is not why you might choose to do a natural birth for you, these selfish reasons, what you want, but really from what baby wants. And so I'm going to share with you 5 reasons why your baby wants you to have a natural birth. So are you ready? So the first reason is this: baby will be more alert. Now, babies born naturally without medication tend to be more alert, responsive, and have a higher ABCAR score. Now, what's an ABCAR score, I hear you saying? Well, the ABCAR score was invented by a lady called Virginia Abcar in 1952, and it's basically a simple and replicable method to quickly summarise and assess the health of a newborn straight after birth. And basically, the ABCAR score evaluates the newborn baby on 5 criteria, and they are these: appearance, pulse, grimace, activity, and respiration. Now, I can't quite work out if she came up with those words because they matched her surname or if she renamed herself after her scoring system. I don't know, but there's a Massive coincidence going on there between the acronym and her name. But anyway, that is the system that is used to quickly assess the health of newborn babies. And so, generally speaking, those babies that are born without medication tend to have higher APGAR scores. Now, I guess it's not really hard to see why a baby would be more alert without the drugs. If we just stop and think for a minute about what's happening drug-wise, when a woman chooses to have an epidural, she's doing that to basically kill the pain. And what essentially is happening is that bottom half of her body basically goes numb. And so, given that the medication is also going to be going into baby's system, then it's not hard to imagine what is happening to the baby. When you think that a baby typically weighs maybe around, 5% of the mother's weight? And so if half her body is going numb, then, you can imagine how baby's experiencing that. And so when baby comes out, baby could potentially just be feeling completely numbed out. And so that's why the baby's not doing anything, not responding, not doing much, takes days to recover, because they're just feeling completely and utterly zapped by the drugs. Now, if you just think that you would take a huge amount of drugs like that, how long would it take you to recover? How would you feel in the moment when you're having those drugs? And how might you feel for days after as you recover? Those of you that have taken drugs recreationally might know what that's like, or certainly those that have drank a lot of alcohol and know how you feel the next day when you wake up, and it might take a whole day to get back into and feeling okay again. It's not hard to imagine why a baby is not going to feel really on top of the world the minute it gets earthside. And is that entirely fair to put a baby through that when they never chose that, they never wanted that, they're not under any pain themselves? Why are they sort of experiencing that? So, that's just an interesting perspective that sometimes, certainly that came to me when I was attending all my antenatal class, thinking, well, hang on a minute, why? It just doesn't seem right to kind of force your baby to have that kind of drug experience on its first day of its life outside of the womb. And so that's one of the major reasons why I really wanted to avoid drugs. But the next reason is also a really important reason. And to be honest, all of these are, but this is a really crucial one. A natural birth will create a much better connection between baby and mum and dad. Now, during a natural birth, the baby will benefit from an abundance of all those hormones that are flooding mum's body. And so this helps to create that really strong connection between mum and baby. But also, because they're more alert, they can use their instincts better. And an alert and active baby, when placed on mummy's tummy, will basically breast crawl and go and find the breast and start suckling straight away. Whereas a baby that's kind of feeling the after effects of some drugs will just not be able to do that. And so that ability to be able to start breastfeeding straight away and naturally can just create such a difference in the connection between mum and baby. But also there's more. When you think about the baby being alert like that, when there's an alert baby that's been born, baby is able to look around, have eye contact with mum and dad, and that means baby can create a really great strong connection with dad and with mum as well, because the eye gaze is crucial in forming that connection with baby when it's born. And so this connection with mum and dad really does a lot for baby's stress levels as well, in terms of keeping baby calm, and also for you guys to help you to connect to your new little one. And you certainly hear when there are mothers that have had difficult or medicalised birth, a lot of them say that it took them weeks to start loving their baby, or, loving might be the wrong word, but having that kind of physical bond or that chemical strong love connection that you feel. Certainly when I think about my experience with my little ones, and there really was this kind of almost like this chemical drugged up love thing that I felt very physically in my body when I would just see them. And when I hear women talking about they just look at their baby and they feel nothing, that's kind of, I think, my goodness, they miss out on that real powerful love feeling that is embedded by the presence of all those hormones that are present, that just simply aren't present in the same levels when the body has got drugs in it. And so creating that really strong connection between baby and mum and dad is reason number 2 why baby wants to have a natural birth. Now, reason number 3 is this. easier to breastfeed. Now, of course, it goes back to baby being alert. Baby will be able to find the breast much more easily. I mentioned the breast coral just recently. And so baby will be able to find the breast, begin feeding, latch on and get the crucial first parts of mother's milk, the colostrum and all that really good stuff that baby needs in its first few hours. And that simply does not happen. This breast crawling just doesn't happen when mother and child are both drugged. And so as a result of that, breastfeeding just starts off on a much rockier road and means that mums finds it much harder to connect with baby. And of course, if those breastfeeding difficulties carry on, and they might well do if it struggles on day 1 or 2, then that can cause a hell of a lot of stress for you and for baby in those first few weeks. And that is just not good for anybody. And of course, it means that if you're struggling in those first few weeks, you might not then continue to breastfeed. And of course, that means baby's missing out on the goodness of your milk. And I know that we all know that breast is best, and that's the best, the best option for baby. But that's not always possible because of the difficulties breastfeeding. So, to try and avoid the potential problems, again, a natural birth can really help you on that breastfeeding journey as well. Now, reason number 4 is this: babies cope better with the birth. And that might sound like a really strange one, but, I'm going to be covering this in another podcast, that our births can be incredibly traumatic. And when I'm talking about that from our own perspective, when we are born ourselves, for many people, that experience is a traumatic experience. So when baby is flooded with all the great hormones that we're benefiting from as mum going through that process, when they're experiencing all that as well, then they are much better able to cope with the experience that is being born. And we found through research that the endorphins, those feel-good hormones that we have that are secreted during an unmedicated birth, are found in the placenta and the umbilical cord. So we know that baby gets a good dose of endorphins as well, which, when you've got a shot of endorphins running through your system, my goodness, that feels amazing. And so that is really going to help baby to enjoy that experience and not be traumatized by it. But also the presence of those hormones is going to help baby to adjust to life outside of the womb, as well as making that whole experience of coming down the birth canal a lot more comfortable. Because remember, this is a big shift for baby. They're going from this very comfortable, warm, protected environment to suddenly being out in the open where it feels cold, where it's noisy, where it's bright. And there's all these things going on. All the noises feel a lot more intense. And so that's a real step change in that baby's experience. So to help them to cope with that transition better, the presence of those hormones can really, really help that. And there's also some other research that says that babies born vaginally are better able to cope with stress than those born dramatically by C-section. Apparently, the caesarean birth triggers a dramatic stress response, which could end up setting up the child to always over-respond to stress. So again, having this natural birth can really help your baby to be much better able to deal with stress in its life, which, when you think about just childhood alone, can help you to have a child that's better able to cope with stress and therefore less stressed and less likely to have tantrums and have meltdowns and to give all those problems that we often hear that kids have. So you're basically helping them to set themselves up from a much stronger perspective by enabling them to sort of tap into all those fantastic hormones that give them a much better ability to cope with stress in their lives. And then the final point 5, is this: you're less likely to have a premature baby if you don't turn to medical interventions. So this includes inductions. If you turn to having an induction and you have an injection that triggers labour through using artificial oxytocin, then you're triggering a natural process artificially. But when a baby is born naturally, the baby will arrive when baby's ready. Whereas if you induce labour, who says that baby is ready? Now, you already know my thoughts about due dates. If you don't, then please listen to the podcast episode about due dates and the calculation methods, because the calculation method that is widely used is deeply inaccurate. So if you're being pressured to have an induction based on your due date, then please listen to that due date episode, because you might want to just resist that once you've found out what a more realistic due date could be for you. But if you are inducing a baby, you could be, if you use their due date system, maybe you're inducing your baby 2 weeks early. And so if babies are forced to come out early, one crucial thing happens is one of the things that they're not ready for is their lungs just aren't ready. And so they're more likely to have respiratory problems because of the underdeveloped lungs. And that is directly linked to prematurity. So you just don't want to have a premature baby where you just don't need that. If there is no need to bring baby out early, if it's just a question of due dates, as opposed to a question of babies in distress, there's an issue with heart rate, there's an issue with blood pressure. I'm not talking about situations like that. What I'm talking about is if you're being encouraged to have an induction because you happen to be past your due date, then this is not going to be good for baby and could lead to problems, well, like I said, in the areas of respiratory problems and things like that, things to do with the lungs. So those are 5 reasons why your baby will want you to have a natural birth. But I have got some more to share with you, because I do admit there is quite a debate out there as to whether epidurals should really be included in a natural birth. And so some women feel, well, actually, if I'm birthing vaginally, surely that's natural. If I have epidurals, then that's going to help me cope, which is going to be better for baby in the long run. And absolutely, if that's going to be right for you and that's what you want to do, then why not? And I'm not here to judge or to pass judgment on any decisions here. It's seriously just about being well informed. But there are some benefits of vaginal delivery over going the whole hog and having a caesarean section. So I just wanted to share with you what the benefits of vaginal delivery are over a caesarean section delivery. So here are 4 benefits of vaginal delivery. Now, I've mentioned this already. This is sort of touches on one of the last points I raised, but they've got a lower risk of respiratory problems. And why is this? Well, babies born by vaginal birth, basically, the compression of the baby as it comes through the birth canal forces the amniotic fluid to come out and therefore prepares the lungs to breathe in air, because up until they're born, they don't have air in their lungs, it's filled with fluid. And so their exit through the birth canal almost squeezes all that liquid out, so they're able to take their first breath of air. But that process isn't happening when there's a caesarean birth, and so you've got a higher risk of having respiratory problems with babies born by caesarean, and therefore there's a higher risk of asthma. And the second benefit of a vaginal delivery is this: the babies benefit from receiving protective bacteria. Now, as they pass through the birth canal, there's loads and loads of bacteria that kind of colonise that area and the intestine, and they're basically all in that area and enable the baby to benefit from receiving that bacteria on their way out. And this can be really, really helpful in boosting their immune system and giving them a balanced immune system. And that benefit can go from childhood right through into adulthood. Now, reason number 3 for a good, for vaginal delivery is this: there's less chance of developing diabetes. There was a European study in 2008 that found that babies born vaginally had a 20% lower risk of developing type 1 diabetes than babies born surgically. Now, I will share, I'm citing a lot of researchers, so I will be including my sources of the research on the podcast show notes. So if you want to check some of this out, then feel free, please dive in and get this information for yourself, because it's really important that you feel well informed and that you're making the right decision for you from a place of knowledge and not from a place of fear. That's the most important thing, is that you're making an informed choice. And then 4th point, the final point, why, a benefit of vaginal delivery, and that's this: it avoids the potential health risk associated with the caesarean. There are a number of risks associated with the caesareans, and I've mentioned one of them already, the breathing one. There's an increased rate of asthma and also allergic rhinitis. And also, children born by caesarean are more significantly likely to suffer from things like celiac disease and be hospitalised for gastroenteritis. So that's just some of the research that I've picked up on in terms of some of the risks of caesarean. Now, we will be doing a separate podcast episode about caesareans, so do look out for that, where we'll be going into a lot more detail on some of these things. But that is basically the 4 benefits of vaginal delivery. So a lower risk of respiratory problems, babies benefiting from receiving that good bacteria that comes from coming through the birth canal, less chance of developing diabetes, and avoiding the risks of caesarean that include asthma, having allergic rhinitis, or suffering from things like celiac disease. So, I mean, all in all, when you listen to all of that, it does sound like quite a compelling case that you need to, if you can in the first instance, certainly have a natural birth where there aren't any drugs present. But if on the day you do need that support, you do need the additional help because the pain is too much for you, then sure, you need to go ahead with that. But then to understand what the benefits of still going through with the vaginal delivery versus making the choice and going for a caesarean. So like I say, what I wanted to do is share with you today information to help you to be better informed so that you can make a decision that's right for you and for your baby, rather than being forced into a decision where you don't feel you are making a choice, but you're simply going with the flow. Going with the flow during birth is not really the right way to go. You really need to be making positive choices to help you to go in the direction that you want it to and feel like you are being the one making choices, because the women that tend to suffer after birth are those that feel that they didn't have the choice, that they weren't making decisions, and that they were being forced into doing certain things and things that they weren't very comfortable with, or that they didn't feel they were well informed at the time on the decisions that they made. And that's why it's really important to spend time doing this kind of homework. So I hope that this episode has been useful in helping you to become better informed. Like I said earlier, I'm going to be sharing some of the sources of the research that I've been sharing during today's podcast in the podcast show notes. So just feel free to visit the podcast show notes at fearfreechildbirth.com/natural. That's where you're going to find today's episode. And so you'll find lots of sources of information there for you to continue your learning journey. And that's, like I've said before, I'm not an expert in birth. I do not push myself forward as an expert in birth, but I'm merely here to help you to get rid of the fear, help you to become better informed, point you in the right direction, and support you on your pregnancy journey so that you can have a fear-free childbirth. I hope that today was useful. If you have any questions, then please come and let me know at alexia@fearfreechildbirth.com. And remember, you can come and find us on the Facebook page, so do come and like us over there. Until next time, bye for now.
Thank you for tuning in. You've just been listening to Alexia Leachman from the Fear-Free Childbirth podcast. If you enjoyed the show, she'd really love it if you left a review on iTunes or Stitcher, or shared it with a friend. And don't forget, to get a free chapter from her book, head over to fearfreechildbirth.com to get your copy, as well as finding other episodes in this podcast and more about how Alexia can help you with pregnancy and birth preparation coaching. Until next time.